The Ontario government is overhauling its autism program in an attempt to clear a backlog of 23,000 kids waiting for treatment. Some of the changes include giving funding for treatment directly to families instead of regional service providers, with funding of up to $140,000 dependent on the age of the child. It also includes doubling funding for diagnostic hubs, cutting funding for families earning over $250,000 a year, and committing to clearing the wait list within the next 18 months. We're going to hear from the minister in charge in just a few minutes, but first, Bruce McIntosh resigned from his position with the Ontario government today when the changes to the autism program were announced. He's a co-founder and past president of the Ontario Autism Coalition, and Mr. McIntosh joins me now from Toronto. Hi there, thanks for being with us, really appreciate it. Why exactly did you resign? Because I can't stay around to defend the indefensible. What the government has done today is utterly wrong-headed. They're allocating funding without regard to need. I'm absolutely amazed that this would happen. The minister noted in her comments that she understands that there's a range of need, and yet they're giving the same amount of money to every individual kid. It's as though you took all the kids who need eyeglasses and gave them the same prescription. The minister has made the point that there are these 23,000 kids on a wait list, that there has to be a way to clear that wait list. Is that not a fair point? What's the alternative to doing what they've announced today? Well, the program can be run very differently. There was work left undone prior to the election, and the roadmap was there to improve things. There are programs that are ABA-based that work with children at the low needs end of the spectrum that address their needs promptly and are not of long duration, but these haven't been implemented yet. We talked about what so-called focused ABA, but it was not very well defined as to what that would actually be when it was delivered. Can you explain what you mean by that, just for our viewers who aren't familiar with the way treatment works? Right. Well, children with autism have deficits in three areas. There is a behavioral challenge, there is a communication challenge, and a deficit in social skills. They will exhibit these in varying prominence of each of them at different times. So the purpose of the ABA program is to work on the behaviors as a key into the other bits of skill building. But the range of skills and the number of domains of functioning in which work is needed is going to vary. So focused ABA might be one or two, perhaps, behaviors. It might still be intense. I mean, if the child's behavior of concern is, bolting out into traffic, then you're going to work pretty hard on that. But oftentimes, an ABA-based social skills program can meet the needs of the milder kids, and their needs are met, and they move on, and you get the money back to then spend on the other kids who need more intensity. Are you saying, sorry, that the money announced today, or what was announced today, should have been geared solely towards the sort of higher needs kids versus the programs that you're talking about that would be more geared towards lower needs kids? Well, it needed to reflect need. That's what was absent from the announcement. We have now, this government is creating equality without equity. So when I see that $140,000 envelope, what wasn't talked about was that there's a $20,000 annual cap for children under 5. And a high needs child could need a program that could cost $70,000 to $80,000 a year. $20,000 doesn't even come close. And the notion that suddenly, because they hit their 6th birthday, that their needs will be less, because of course after their 6th birthday, that annual fee funding goes down to $5,000. We had this fight with the previous government. They wanted to kick about 1/3 of the kids off the wait list and give them $8,000. This government wants to eliminate the wait list and give each child $20,000. It's
I don't understand why they didn't learn from that experience three years ago.
I want to read to you, the government is on the subject of your resignation and the reasons that you're providing now. The government pointed us to a tweet from the Chief of Staff to Lisa MacLeod. He says that he's met with Ontario Autism on a few occasions. Our plan satisfies 14 of the 19 demands that would keep them from protesting. And he says, as for you, he was informed he could resign in December.
Well, Mr. Porter is, I was not part of the meetings that the Ontario Autism Coalition had with Mr. Porter. My wife took those meetings. She has told me that she cannot find a group of 19 recommendations, and we don't know which 14 this is supposed to address. But Laura wrote an op-ed that the Toronto Star published about 2 weeks ago, in which she gave a list of 3 things that the OAC wanted the government to do and 3 things that they did not want the government to do. And the government hung their hat on the first item in the don't do this column.
Is that the
ignoring need?
Okay.
That kind of makes any other things they may have done, well, not count for quite so much.
Can you help us understand, outside the politics of all of this, I guess the reality of being one of the people on those waiting lists, the reality of being a parent of kids who aren't able to access the services they need? Help us and our viewers understand, you know, why these changes, why changes in general were being asked for so frequently.
Well, there are too many people on the wait list, and they are still waiting too long. Mind you, my son, my older child with autism, was on the wait list for 4.5 years. So it's very difficult to try to persuade parents these days that, you know, the 1.5 to 2 years that they're looking at is a significant improvement. But it's still not good enough. But there are ways to get this to improve that are not this cookie cutter way of distributing funding. The government needs to invest in training more people who understand ABA and can deliver it. They need to build accountability processes into the behavior plans. In the United States, the insurance industry pays for behavior analysis, and every single behavior plan gets a second look. It has to be justified. There has to be data to support the recommendation that the clinician makes. We didn't get to do that here. We ran out of time. But without even examining that option, or if they did examine it, they opted not to do it, this government has just walked away from the problem.
Why not stay and advocate for what you're talking about? Why not stay and treat this as a first step and try to advocate for improvements?
The minister's office made it very clear to me several times that they were not interested in listening to what I had to say. I did offer advice and suggestions to Amy. I trust that she took those forward.
That's the MP you work for, right?
That's correct. I don't know MPP. What the nature of her conversations were, but clearly it didn't get into the final product.
Okay.
And that's a disappointment.
All right, I'll leave it there. Thank you, Mr. McIntosh. Appreciate your time.
Thanks for the opportunity, Valshi.
So what went into the government's strategy? Lisa MacLeod is Ontario's Minister of Children, Community and Social Services, and she joins me now from Queen's Park in Toronto. Hi, Minister MacLeod. Great to see you. Thanks for coming on the show.
Thanks for having me. I really appreciate it.
Minister, we just spoke with Bruce McIntosh, the legislative assistant to Amy Fee. He says he handed in his resignation today because of your government's announcement. Essentially what he says is that the announcement, the plan that you've announced to get rid of to end the wait list, to get people off the wait list, essentially ignores the fact that kids with autism have varying degrees of needs. Is he right?
Well, I've been pretty clear that if you meet one child with autism, you've only met one child with autism, that each child and each diagnosis is different. What I find appalling from the Ontario Autism Coalition, which Mr. McIntosh used to be the president of and his wife is now the president of, is they would prefer to ensure that lower income and middle income people that are in need of services right now not get the services they need, and they'd also continue to deny 23,000 young people across Ontario that have autism services as they're denied right now. So, you know, he wasn't a key figure in our administration, and his organization has become more of a professional protest organization. So I just keep that in mind when you listen to the criticisms. We in fact went to their group and offered to and have implemented 14 of their 19 recommendations. They simply can't take yes for an answer.
Why did you go to the group though if you thought it was just a protest group?
Well, you know what? We've consulted with everybody. We've had conversations with all of our stakeholders. We try to improve the system as best we can. I'd like to keep in mind that we have $321 million invested into this program, and at this particular time, we only are serving 8,000 kids when 23,000 are languishing on a wait list. So that's about 75% of the kids are being denied service as a result of the previous Liberal administration's program. And that $321 million ran out in June, and I had to go back to our Treasury Board twice to secure $100 million so the program wouldn't bankrupt itself in only supporting 25% of the children. So we're very pleased that we're now going to be able to clear the wait list for those 23,000 children, and we'll be able to do that in the next 18 months, and we're going to do it in a few ways. The first is we're going to double our investments into diagnostic hubs like Holland Bloorview, where I was today in Toronto. We will invest in Children's Hospital of Eastern Ontario, where I'm from, and we'll make sure that there's direct funding that goes to parents so that they can choose the services they want, whether that's behavioral services, technological services, respite care, or caregiver support. So
yeah, Minister, I understand. Sorry to interrupt. I understand what you're saying 100%, but you also, another thing you're doing is capping funding, and that is where some of the concern, and I take your point about about the group and the number of suggestions that you say your government has met. But if you cap funding at $140,000 for a child in treatment from the ages of 2 to 18, intensive therapy for a high needs kid can cost between $60,000 and $80,000 a year. So that would only pay for 2 years of treatment for someone with high needs.
Well, no, because there will be an annualized amount of money that families will be able to receive up until $140,000 to the age of 18. What's unreasonable is organizations that would suggest the 23,000 children, some of whom have extremely high needs, would not receive service because they're waiting for an indefinite amount of time, either to try and get a diagnosis or to try and get service. That's unconscionable, that's unfair, and as I've just explained, why having to go back and get an extra $100 million because it was on the verge of bankruptcy, it was unsustainable. So the best process that we could ensure to get children off the wait list and to ensure that everybody was getting something was to ensure that we went to this model and that we focus on what I would expect some of the critics would suggest is early intervention. And we know that that works best between the ages of 0 to 6. So that is our focus. We've lost an entire generation as a result of mismanagement in this program. And, you know, I'm somebody 13 years ago with my NDP opponent, Laurel Gillespie, who has endorsed this plan. She and I started the South Nepean Autism Centre in the city of Ottawa because we recognized there needed to be more support. So, you know, I'm confident that this is going to erase the wait list in the next 18 months. We are going to support direct funding to families, and we're going to build better capacity in our diagnostic.
Minister, the question is, will it erase the list because people will no longer be able to access the kinds of treatment they need because there is that cap on funding? And you said annualized. I understood it to be $140,000 total.
No, it's $140,000 between the ages of 0 to 18. We've brought in Autism Ontario to help navigate that system for families.
But if it costs you $70,000 a year to be treated at the high end of the spectrum, and you're 2 or 3 years old, how will you sustain that until you're 18?
Well, the reality is it's either allow this program to exist for 25% of the kids or do what I want, ensuring that all 100% of the kids that need support get the support. And unfortunately, that means tough choices, and that means that we have to we increased the budget from the Liberal budget of, they were at $256 million, I'm at $321 million, but we're going to continue to provide supports for all of those children. But I must say, we all recognize that early intervention is key. And if we can make those investments in the early years where they'll make the biggest impact, I think the downstream effect will be very positive. I also feel that because we are focusing more on oversight with respect to the practitioners, we're going to see that tightened up as well and potentially some savings for families down the road. But I think this is about empowering families to make the choices that are in the best interest of their families, but also by clearing off that wait list. If anyone is trying to advocate to me to only keep a program for 8,400 children while 23,000 children are denied service by their province, I'm not going to follow that model. It was unfair, it's inequitable, and it was unsustainable.
But isn't that sort of ignoring the fact that there could be a different model? That I see what you're saying, that there's only so much money, and either you keep the wait list or you try and get rid of it. But what about more money? Is there the possibility, for example, in the budget of increasing the amount of money dedicated towards autism services and to clearing the wait list, and therefore not having to exist within this cap that those people say will disproportionately hurt high needs kids?
Well, you know, that isn't true, because 23,000 children right now are being denied service and any funding at all. I want to point that out. The second thing I want to point out is, since I've become minister, in a government that is committed to balancing our fiscal responsibilities with a $15 billion deficit, I was able to secure more money than the previous Liberal minister did, increasing our allotment from $256 million to $321 million. So we have made that commitment. In addition to that, I had to go to Treasury Board twice to sustain the existing program for just 25% of the kids, with an extra $100 million infusion of emergency money. So
is your total spending $421 million or $321?
We're now at over $321 million, and an extra, I went to Treasury Board twice for the extra $100 million. The reality is the system today is broken. Anyone that suggests that this system is fair, sustainable, and equitable is wrong. It has punished 23,000 children of varying ages, of varying degrees on the spectrum, and who may never know if they're ever going to get service or if they're going to age out before their number comes up. What we're providing is some continuity and some stability, and we're going to erase that so that parents, we understand when they get a diagnosis, it can throw a family into crisis, and what we want to make sure is that we get that diagnosis more quickly and we get them the direct funding more quickly. But if anyone is telling me that the system under the previous Liberals that only serviced 25% of the kids is right.
To be fair, that's not what they're saying, though. That's not what they're saying. They're just saying that yours necessarily, while it might clear the backlog, won't make it perfect, that there could be another alternative, and would that require more money? Is that even possible?
Actually, we've looked throughout Canada, we've looked throughout the world. This is the best model for a made-in-Ontario solution to get more kids off the wait list and into the services that they need. And in the long run, this will be the best program and the best option for everyone. But let me be clear, this is about making sure that every kid in Ontario is protected if they've got autism, and that we are giving them a fighting chance. I couldn't in good conscience continue with the Liberal program as it was. It was absolutely cruel to deny 23,000 children service from their government.
Okay, I have to leave it there. I'm out of time. Thank you so much, Minister MacLeod.
Thank you.